Look at my Chelsea. Did y'all do, hey, Chelsea, did y'all do graphics? Your neck, what? Good point. I was like, I feel like I'm right on top of it. What, this whole thing, right? Yeah, spread out a little bit. Okay. Okay, are we ready, guys? Is this on? Gil? Hello? Is this on? It is? Okay. Yeah. Okay, no one's standing. No one cares. Oh. Okay. Okay, we're ready to go. Okay, good afternoon, everyone, and thank you all for being here today. We wanted to inform everyone that as of last Friday, the state of Texas approved an additional dose of the mRNA vaccine for the immunocompromised. So you may be asking, what is the difference between an additional dose and a booster dose? An additional dose refers to people who are moderately or severely immunocompromised, needing an additional dose of an mRNA COVID-19 vaccine, which is either the Pfizer or the Moderna, at least 28 days after the completion of the initial vaccine series. So this is because they may not have received adequate protection from their initial two-dose vaccine series. A booster dose is an additional vaccine given to people when the immune response to the first two vaccines is likely to have weakened over time. The need for and the timing of a COVID-19 booster dose has not been established, and boosters are not recommended at this time. CDC and FDA continue to review evidence and data, and as it is available on whether or when boosters will be needed for the general public. And we will, of course, update you on that guidance as we get that information. Remember, I want to just reiterate, what has been approved is not a booster shot, but a third vaccine. So if you have a moderate to severe compromised immune system, there will be a mega drive tomorrow, Wednesday, August the 18th, from 9 a.m. to 3 p.m. at the American Bank Center. So the City County Health District will have 10,000 doses available. If you received the Pfizer vaccine, you will receive Pfizer as the third dose. And if you received the Moderna vaccine, you will receive Moderna as the third dose. If you have any questions about whether or not you are immunocompromised, please consult with your doctor. You can register for the Mega Drive on the cctexas.com website under COVID-19 vaccination registration tabs. And if you have any questions, you may call the City County Health District at area code 361-826-7200, option 2. Additionally, if you have a moderate to severe compromised immune system and you wish to be a part of the in-home vaccination program, you can call the city's customer service line at 826-CITY or 826-2487. When you call the city's call center, you will be registered, and the fire department will then call you to schedule your third vaccination dose. The Corpus Christi the Corpus Christi Fire Department is working very hard and have adjusted their schedules to be able to provide you this service. And we thank them. We thank Fire Chief Rocha, who is proudly administering on average 80 to 100 in-home doses a day. In addition, if you have a moderate to severe compromised immune system and received your vaccines from the Save Our Seniors program that began in late January, you will receive a call from the City of Corpus Christi about the option of receiving this additional vaccine dose in your home. We are doing our best to make sure that the most up-to-date information is given to you and provide you with the resources as soon as we have them. We must continue to protect ourselves and our families, and we encourage you to get vaccinated as soon as possible or you are able to. So with that, we'll have Gabby give us a Spanish translation, and then City Manager Peter Zanoni will have a few words.
El estado de Texas aprobó la dosis adicional de la vacuna de ARNM la semana pasada. Una dosis de refuerzo es una dosis de vacuna complementaria que se administra a las personas cuando es probable que la respuesta inmunitaria a una serie de vacunas primarias haya disminuido con el tiempo. Le queremos reiterar que no se trata de una vacuna de refuerzo, sino de una vacuna adicional. El día de mañana se va a llevar a cabo una clínica de vacunación masiva en el American Bank Center de 9 de la mañana a 3 de la tarde, solamente para las personas cuyo sistema inmune se encuentra debilitado. Se le pide a la gente que se registre llamando al 826-CITY, 826-2489. Como parte del programa SOS y el programa de vacunación en el hogar, los bomberos continuarán administrando la vacuna ARNM adicional. Las personas pueden recibir esa dosis adicional 28 días después de su segunda vacuna. Le recordamos que esta vacunación masiva se va a llevar a cabo el día de mañana en el American Bank Center de 9 a 3 de la tarde.
Okay, thank you, Gabby. As we know, and as the community knows, as a city, and we're proud to be here today with the mayor and the city council who have led our policy directives, as a city, we're providing all the resources and tools necessary to make sure we're protecting our community and that we think about the community first. It's important to realize that because our cases are going up. In fact, our health director just texted us the numbers for today. So today, there's 607 new confirmed cases, which is one of the highest numbers, I think, in many, many months. Yesterday, it was 554 new. So today even surpasses yesterday. So it's important that we protect the community, and the mayor and council behind me, that's their top priority, is protect our community first. With this newly approved vaccine for the moderately or severely compromised, it is imperative that we focus on ways how we can get that vaccine to the community and make it available to everybody that is eligible to receive it. We must stick with the state mandates and abide by CDC guidelines, but having this extra vaccine for those who have a weaker immune system and acting quickly to provide it is critical, and that's what the city is doing. And so with the Mega Drive vaccination clinic that'll take place at the American Bank Center, and with the mayor's innovative in-home vaccination program that our fire chief and firefighters will administer, these are a few ways, and more will be coming, of how we can get that vaccine, that third vaccine out to those that have weakened immune systems in our community. We also want to point out that our fire chief, as recommended by the mayor and city council, have our AMBUS, our emergency ambulance, if you will, available today at one of our area hospitals to help with their overcrowding in the hospital. So with the extra COVID vaccine testing sites, the use of our AMBUS, the mayor's in-home vaccination program, these are just a few ways that the city and the county are coming together to bring resources to our community at this critical time. We can only lower our numbers and lower those numbers in our hospitals as well, but we have to work together as a community. And so I want to remind the community of our protocols that we do have that have worked. One is get vaccinated if you haven't already. 2, wear a face covering when you're in a public setting that can be an area that is high COVID transmission. Keep your hands off your face, your eyes, your nose, and your ears, and stay social distance and stay safe. With that, we're going to have this translated into Spanish.
Como ciudad estamos proveyendo con todos los recursos que podemos para proteger a nuestra comunidad. Con esta nueva aprobación para las personas con sistemas inmunes débiles, es de suma importancia que hagamos esa vacuna disponible. También debemos seguir las reglas del Estado y las pautas de los Centros para el Control de Enfermedades. Con la implementación de la ambulancia ambos del Departamento de Bomberos, se va a dar mucho más espacio para las personas que necesitan de atención médica de emergencia. También contamos con lugares adicionales para vacunarse, así como el programa de vacunación en el hogar. Nosotros podemos lograr que las cifras disminuyan si trabajamos juntos. Le continuamos sugiriendo que tomen todas sus medidas de salubridad.
So, thank you very much, Annette Rodriguez, Health Director. I also wanted to mention something that's a little bit of a change for everybody, for the community, because of our high increase in COVID cases. Today, 607 confirmed cases, 674 total cumulative cases today. What we're doing is, at the Health Department, is we're reverse alerting all of these positives. All 674 individuals will be reverse alerted that they are positive. Now, I do know that some households give us one phone number for 5 or 6 people, so you just have to call us, and so we can figure out who the right person is. But we're basically reverse alerting you, because what we're trying to do is we're trying to figure out a mass system to be able to get you monoclonal antibodies. Monoclonal antibodies, if you take them when you're COVID positive, you have a 70% chance of staying out of the hospital, and that's what we're trying to do. So if you would call us, we're working on a referral system. We'll be filling it out for you. If you meet eligibility, we will fax it over to the RIC, which is the Rapid Infusion Center in Robstown, and we'll get you in within the next couple of days. You have to be symptomatic for less than 10 days, so there is some criteria that you need to meet. So I think that's really important for the community to know. We're not just calling you to tell you you're positive. We're calling you because we need for you to call us back at the 361-561-1101 call center, so we can actually help you to get the monoclonals. Even if you're not feeling sick, we still want to encourage you to get the monoclonals, because they can keep you out of the hospital. So please, if you're COVID positive, if you meet eligibility, please go. It's free of charge, and we think it's very important to try to keep these numbers controlled with the Delta variant circulating, and to keep from inundating our hospitals, our healthcare systems, so that they continue to have capacity for others that actually need acute care. Thank you.
Quiero mencionarle de algunos cambios que hemos tenido el día de hoy, comenzando por el día de hoy, que se reportan 674 casos. Las personas positivas están recibiendo información mediante el sistema Reverse Alert. Le pedimos a las personas que reciban esa llamada que nos llamen también a nosotros para poder darles información de todos los tratamientos que están disponibles. Las personas que se les llamó por Reverse Alert, se le pide que llamen al 561-1101 para recibir más información. También le queremos recordar que muchos de nuestros servicios son gratuitos.
Thank you very much, Gabby. Let me just say, Mayor, City Council, this is a total team effort of working together with our health department, working with the fire department, making the vaccine available to our residents. And I pledge to you, Mayor, that the fire department is going to do everything that we can to get the vaccine out in a timely manner. We ask people to be patient, but we will get to you. But I want to thank you for allowing me to say a few words with regards to this, and we want to make sure we get our people vaccinated to keep our people safe. Thank you, Mayor.
Le quiero decir que este es un esfuerzo de equipo por parte del Departamento de Bomberos, así como la oficina de la alcaldesa y el resto de los departamentos de la ciudad. Le queremos pedir que tenga paciencia con nosotros, pero vamos a hacer todo lo posible por llegar a todos los hogares y vacunar a las personas que se hayan registrado.
Thank you, Gabby. That will conclude our briefing. Thank you.